renowned Dr. Zirak Marker is a renowned child and adult psychiatrist and psychotherapist with clinical training at the Westchester Medical Center in New York. He has over 18 years of clinical experience in educational psychology and is currently the medical director at the Aditya Birla Integrated School, which is for children with different learning needs, psychological, emotional, or behavioral concerns. Without taking up much of your time, over to you, Dr. Marker.
Thank you. Thank you for that introduction. So I know I have a short time, so I'll try and make it as interactive and crisp as possible. Of course, I can go on. I mean, youth and youth mental health is a topic in itself that can stretch on. So I've tried to make it more crisp and relevant to the population that's here. Firstly, I would just like to say that there is such a high need, right? I mean, if you look at the cases, at least I am seeing, and that too in schools or colleges, there's such a high increase and more cases in, say, simple things such as bullying, right? Whether it's physical, verbal, sexual, online bullying, there's so much of more addictiveness, if I would say, addiction towards social media, addiction towards screen time, addiction towards your PUBG and Fortnite games and things like that. So many more youth are walking into bathrooms in schools and cutting their wrists, right? Self-harm and self-cutting has become so high that I can't tell you. And of course, when you talk to teenagers and young adults, you realize that for them, it's a way of dealing with sometimes psychological or emotional pain. And they tell you that sometimes this physical pain it kind of relieves the emotional or the psychological trauma or pain that they may be experiencing or going through, right? So much of more discrimination, even amongst youth, I see it amongst children, amongst teenagers, discrimination or marginalization based on socio-economical background, status, skin color, disability, body image, even the size of the homes that you have, religion bias. The list is endless. There's such a high experimentation need that's going on even with the youth on cigarettes, alcohol, marijuana use has become like an epidemic in itself, where every second or third young adult or teenager I know is abusing or using for recreation marijuana more than 4 and 5 times in a week, right? And of course there's so many more dysfunctional homes that we're coming from. There's so much of a higher increase in family separations, divorces, and just awful family or toxic family lives, as we call it, right? So with all of these aspects, mental health has become a crisis in itself. Of course, I'm not going to get into why these 6 months too have contributed to this, but that is actually quite, I think, obvious, right? I mean, the tagline of this is the new normal is anything but normal, right? I mean, we're not meant to be cooked in, all under one roof. We're not meant to be living the way we do, especially for the youth. There's no outlet, there's no social interaction, there's no, meeting of friends and bonding. Online education is another ball game altogether. There's a lot of boredom, there's a lot of frustration, irritability, parental conflict with the youth. I can go on. I mean, there are teenagers who actually privately tell me in my counseling sessions that I hate getting up before 12 or 1 because I want least interaction with the house or with my parents at home. So there's a lot happening, right? And I think a lot of parents are under a lot of stress with the uncertainties of the future, from financial aspects. There are job losses, there are pay cuts, there's so many aspects there with the COVID-19 in itself. And also this is leading to more and more kind of conflict. I cannot tell you how high the verbal, physical, and even sometimes sexual abuse has gone up in these last 6 months, right? So with all of this, why the importance of mental health and taking care of our youth is WHO as of states today that India is the most depressed country in the world. I'm just going to share 5 statistics with you all based on the current WHO findings. One of them is that they say that 1 in 6 children between the ages of 10 and 19 actually are suffering from clinical depression in our country. And what is sad to know is, imagine this stat says that by the time there is the onset of mental health symptoms, and the actual intervention is about an average of 8 to 10 years. Imagine how sad that is. That in any kind of youth-based conflict or mental health issues, by the time that's identified and by the time there is intervention, it's about 8 to 10 years. And this makes it also relevant to know that 50% of all mental health conditions and disorders start before the ages or at the age of 14 years of age, right? And of course, suicide is the third leading cause of death in our country amongst 15 to 19-year-olds. And the last statistic says that there is, as we speak, there is one suicide attempt every 3 seconds and one death by suicide every 40 seconds. Now, when you just hear this, you get alarmed. And yet, there seems to be such a lot of, I would say, stigma and bias and judgment when it comes to mental health, right? I mean, tomorrow, if our kids or if we have a cavity or a toothache, we're not going to think twice. We will go to our dentist and get it fixed. If I have a viral stomach bug or an infection, I will start an antibiotic. If I have like a fracture, I will go to my orthopedic surgeon. And yet, when we go through any form of mental health concerns, we don't reach out. We don't go to a mental health professional or a psychologist or a psychiatrist. And the reason for that is endless. Just to highlight a few, I think a lot of us, and especially sometimes parents, there's a fear of being labeled or judged. Sometimes parents tell me that, they've intuitively known something's not perhaps right, but they've felt that it's a sign of weakness or maybe a failing on their part for their child. And that's why they don't want to perhaps seek the right help and the intervention when required. Or sometimes people feel that, okay, only if you're absolutely crazy, you go see a psychiatrist. And these horrible words, right? You're crazy, you're mad, you're psychotic, you're psycho. All this puts, mental health completely at the back burner, right? And of course, the feeling of when you go to see a mental health professional, the stigma is that you'll be put on medications. Those medications will cause side effects. You'll have to take them for life and you'll get addicted to them and they will cause weight gain. And, again, the list is endless. And that's actually so not true, right? I mean, in fact, some of the best scientifically engineered drugs today, which are far sometimes safer than even paracetamol that we so use for headaches and coughs and colds, are psychiatric medications for depression or anxiety. And they were manufactured and FDA approved even sometimes for children as young as 8, 9 or 10 years of age. So that's how safe they are to be used. And of course, if the clinical diagnosis warrants it, right? So what we also have to understand is that this is not a phase. When you talk about what mental health is, I'd love to think of mental health as a spectrum where you have wellness on one side, right, which we all have and strive for, and you have illness on the other end of the spectrum. Now, between that, we'll tell you exactly the difference between what and when you need psychological intervention and when you need psychiatric intervention. Now, all of us, me included, I'm sure all of you, we've all gone through some kind of life's distress or the other, right? Whether it's a heartache, a breakup with our girlfriends and boyfriends, where we've thought it's the end of the world, or setbacks with our parents. I think most of us, when I was in school, I went through a terrible time where I was kind of ragged and bullied, and I went through a lot of anxiety for 2 years. And again, no help, right? I mean, I couldn't open up to my parents then because my mom was suffering from cancer. And in those days, there was no mental health support or counselors in school. And, I realized then how badly damaged I was afterwards when I started studying psychology and psychiatry, and I realized the need then for youth and the hour of it now. So when you look at all of that, all of us have our trying times, but those are psychological, emotional, and they pass, and they usually have triggering factors. So it is not every time we go through a life setback that doesn't mean we have anxiety or clinical depression. No. When it starts becoming more, I would say, difficult to manage and cope with, right? When the symptoms start becoming extremely difficult to function with, where functionality gets lost. I mean, I have clients who tell me they can't get up in the morning. They don't want to face the day. They haven't had a bath in 3-4 days, or sleep and appetite and other symptoms, which I will get into, have created complete dysfunctions where they can't seem to focus and concentrate on actual day-to-day life and living. Well, that's what makes it clinical. Like how we have hormones in our body, there are certain neurochemicals in our brain, which sometimes with or without a triggering factor can get imbalanced. I think most of us have heard about dopamine, which controls our thoughts and our cognitive processes. The main neurochemical in our brain that is responsible for all these aspects is called serotonin. Now, when serotonin gets imbalanced without any reason, sometimes one goes through actual clinical signs and symptoms of depression or anxiety, right? So it is like a health condition. It's like getting my blood test done and finding that I have high blood sugar levels or diabetes or high cholesterol levels, right? So when there are clinical symptoms that don't seem to go away after 2, 3, and 4 weeks, and it's actually affecting how you feel and how you function, you need to go and seek professional help. So mental health is emotional, psychological, and social well-being. It's how we think, it's how we feel, it's how we feel, our mental balance, right? And the resilience and the coping mechanisms that go with all the trying times in life, right? So when you look at the flag signs, right? So of course I can't get into every disorder because, right now the youth is grappling with anxiety for sure, with panic attacks or anxiety attacks. There's depression, there's OCD, there's schizophrenia, there's substance abuse. There is situations like, learning disabilities and ADHD as well. And of course, OCD, which is your obsessive compulsive disorder, right? I'm going to highlight the two most common kind of syndromes, right? So what are those red flags? Like when you have yourself struggling with these symptoms, or you have a loved one that's going through it, or a friend who's going through it, what do these symptoms look like, right? So I have clients who tell me, or youth that come and tell me that they are constantly feeling a persistent change in mood, either with irritability, just not feeling themselves lately, mood swings that go from feeling okay to not okay, a persistent perennial sadness of mood. So of course, when you're occupied, sometimes they feel when they're watching their television or Netflix shows or interacting with friends, they seem okay. The minute they come to a baseline mood, when you are with yourself and you have this constant feeling of sadness or lowness or irritability, then there are symptoms of a lack and loss of interest in almost everything, where clients tell me that even sometimes just going for a shower is a struggle. Getting dressed and wearing clothes is, sometimes not of an interest. You sometimes lose interest in kind of activities or hobbies or other interests that you may have. This also, then there are also sometimes changes in eating patterns or sleeping patterns. So either excess of it or less of it. So sometimes clients tell me that they overeat and they binge eat. Sometimes there's just no appetite at all. That awful feeling from deep within, like the sense of an impending doom, anxiety, the feeling you get before an exam with a high heart rate, palpitations, sweating, feeling uneasy all the time. Then comes a lack of, just energy. There's no drive, low energy, feeling tired and fatigued all the time. A lot of hypersensitivity where every small thing seems overwhelmed. So clients tell me that they can't deal with even sometimes taking the smallest or the simplest of decisions, right? A constant sense of helplessness, hopelessness, worthlessness, a lot of negative thoughts. Sometimes those negative thoughts can also percolate into suicidal thoughts. And of course, difficulty focusing, concentrating, memory gets affected, learning gets affected, where, students can't actually, study and prepare for exams or even just be there during class hours. All this obviously starts affecting self, right? So self-esteem, self-confidence, self-worth, and memory, and all of these aspects get eroded. So these are your basic, like I said, what we call as red flags or warning signs that something is not okay. When you have also other triggering factors, right? So if, say for example, there's been a recent life-changing event, right? Like say even going off to university, changing homes or residences, a sudden death or loss in the family, or a loss of a close one, or change of jobs, parental separation or divorce, financial distress, academic failure. All these are big triggers naturally. Sometimes even chronic health. A lot of people struggle with chronic health, issues that don't seem to go away. Of course, the most drastic one being like something like cancer, right? That can also definitely affect and impede mental health. Abuse is a huge precipitating and a contributing factor towards mental health, be it physical, verbal, or sexual. A lot of kids struggling today with sexual identity, right? So when sexual identity is confused, or you haven't come out or accepted, or others haven't accepted your sexual identity, that can lead to a lot of kind of mental health stress and problems. And of course, the drug abuse that I talked about. I want to highlight a bit here, because I know that a lot of youth on today's talk, is that studies from Australia and now worldwide are clearly indicating that marijuana specifically, which is so widely abused right now, can not only just precipitate or percolate and worsen, but it can actually cause mental health disorders and illnesses. So you actually have marijuana-induced psychosis, marijuana-induced depression, anxiety, panic attacks. I mean, you name it. And they are also talking of marijuana actually affecting learning, memory, and causing symptoms that are similar to attention deficit hyperactivity disorder, right? So please don't feel and don't for once ever think that marijuana is organic and it's safe and it's safer than smoking. We are seeing too many cases, and think about those neurochemicals I talked about, right? Now, you may be using it for even months with nothing happen. It may take that one bad hit for a neurochemical imbalance to happen that can actually turn your life upside down in a matter of minutes. You can actually have a psychotic break. I'll give you one quick example of someone, a kid who was about 19 years of age, who was obviously typical drinking, partying, going out and all of that, started abusing marijuana. I don't know what happened neurochemically, but he lost control of his thoughts. He lost control of rationality and realistic thinking. And he actually smashed everything in the house. He got extremely suspicious and paranoid, thought someone was spying on him and that his parents were against him and whatever else happened. But eventually he tried to lunge himself out from his 16th floor apartment. And his parents, and luckily his brother and his sister were there, who held him by his ankles and had to bring him back. So you never know. These are all mind altering and neurochemically causing and creating imbalances that one has to be very, very careful of. And I'm saying this because I'm just seeing too many cases. Even in the lockdown, there are youngsters and youth who are acquiring marijuana and abusing it. So please, I just wanted to highlight that a lot, right? So basically, when there is a mental health concern with yourself, with your loved one, with, like I said, someone you need to reach out to them. Sometimes just being there for them, sometimes just letting them know that, what, no matter what, I may not actually know what to say and do, but I'm here for you. Sometimes they say even physically just sitting next to someone who's depressed or had a meltdown or an anxiety attack or is crying, just physical presence of knowing that someone is there out for you, checking in on that person once in a while through messages or phone calls. You never know. Even those small acts of kindness and awareness can actually save a life. Okay. And definitely urge conversations around mental health, right? There should be no taboo and stigma. And if you know clearly that someone is not okay, it's absolutely okay to tell that person or a friend or a family member to go and seek help from a mental health professional. I promise you, we are not scary people. We are not here to judge. We are not here to just sit and label, you guys, and, there's no quick fix, right? It's an amalgamation. And I'm not saying that every mental health concern needs medication. In fact, I, as a psychiatrist, use medication absolutely as a last resort. If I am clear in my mind with my judgment that the person coming to me has a clinical issue that will not go away with just counseling and talking and cognitive behavior therapy, which are the other ways to help someone who's going through mental health concerns, then I would prescribe medication, right? So there are different ways of healing. And typically, I truly believe in a holistic approach. So holistic approach means it's not just the quick fix of a medication or a pill. It's not just counseling and having 2 sessions of therapy. It has to be everything together. And physical health, gut health, and mental health, they're all connected. So even, I call it like the quick 8 or 9 pillars of resilience, right? Because at the end of it all, no matter what we may have, be it depression, be it an emotional setback, be it something psychological, we all wish to have that inner strength, right? Resilience. Everything boils down to resilience, which is that inner strength that comes from acceptability and adaptability, reflection, and rationality, to be able to healthily cope with whatever life throws at you, right? So that you can overcome those difficult challenges or hurdles or adversities of life, and not just bounce back, but thrive from there on. And I truly believe that whatever we go through in life, at least I have experienced that and realized that in my lifetime, that it always happens for a reason. Sometimes things happen for a reason. And those negative adversities have come there in your life to perhaps teach you something. So if you go away with that thought, you realize that you always question your mind and your beliefs as to what is this problem going to teach me, or what has this taught me in my life, right? So quickly to go over certain points to end off this short interaction that I have, is basically looking after self, right? So just, you make sure you're sleeping right. Sleep kind of restores everything, right? It restores imbalances of hormones. I mean, even your gym instructors will tell you, right, that you can't gym every day. You need to have a 1 day's break in the middle so that your muscles grow and your damage restores, right? So taking care of sleep, exercising, right? Physical exercise helps a lot with balancing those neurochemicals in the brain that I talked about. Acceptability, right? Accept who you are, accept the problem for what it is. Only when you truly accept yourself, the situation that is giving you distress, and even accepting others, will you learn to adapt. So according to me, the 2 strongest pillars of resilience is acceptability, and only when you have acceptability, adaptability. The ability to adapt to any situation, right, that life gives you or throws at you, right? And so many times we find it hard to do that because a lot of us have conditioned thoughts, right, that happiness is external. Oh, I'm happy because of I'm good in my studies, I have parents, I have a roof over my head, I have financial stability. God willingly, those things are there. But what if they're not? So you can't externalize your happiness or your feelings and your thoughts. They have to be really, truly internal, right? Because today those things are there. Tomorrow they may not be there. Then what, right? Also, I think we have to grapple with so many times in life the difficult choice of reacting versus responding. 90% of us as human beings react mindlessly. We react from emotions, from our heart, and we don't realize how damaging sometimes that can be to ourselves, to our mental health, and to others in a workspace, with friends, with relationships. So the art of waiting it out, being mindful, living in the moment, and being present, and responding, and trying to think before responding. And time heals a hell of a lot. And time can even, I'm talking of time, I'm not talking of days or hours. I'm talking of sometimes even holding back a few minutes to kind of reflect and then respond can make a world of a difference, right? Purpose, reflection. I love these 2 words because, we go through life and, we reach adulthood without even asking ourselves these questions, right? Like a few hypothetical questions, like, why am I here? What is my purpose in life? Have I made a difference or a mark in my life till date? What lessons have the past problems taught me, for example? Why do I get up each morning? What drives me? What's my true passion that makes me look forward to each day after day after day? And the last hypothetical question, right? That if tomorrow was my last day, do I have any regrets? And most of us, if we sit back and reflect on these questions, there's so much yet to be answered, right? And there's so much more to life that we don't give credit for. And I believe in that silver lining. No matter how bad or no matter how things are in life, I think we really need to strive to look for the good in other people, look for the positives in negative situations, and trying to find the positives in life in general. I mean, human nature and the human brain is such that when one thing doesn't seem to be working out for us, what do our brains and our minds do? We only focus on that one negative thing. That becomes like the big white elephant in the room, right? Whereas if you compartmentalize that, you have so many other amazing things in life that are there for you that you don't even see. And that comes to the last part of my last pillar, like I call it, for resilience, which is gratitude. And gratitude, today's studies have clearly shown that habitually focusing and appreciating on the smallest of things in life that we sometimes so take for granted is one of the strongest elements of resilience. And I think especially at times such as these, when we are all living completely uncertain lives, I think we can just really, I mean, a lot helps with focusing on the small positive aspects in life that we otherwise so take for granted. So I think I'm bang on time. I think 4:30 to 5 was the time given to me. And yeah, so I've tried to cover as much as I could with regards to youth and our mental health. Thank you.
Thank you so much, sir. I think we have time for a question or two, if you wouldn't mind answering that.
Sure, sure.
So the first question that's come to me is, how do you know whether you need to go to a psychologist or a psychiatrist when you're not in the right frame of mind to make the correct decisions?
Sure. A super question. So basically, like I said, we're not scary people, so there's no harm in coming to us first. But that's why I truly believe in what we call as a multidisciplinary team approach. So, for example, the way we function at MPower, which is our mental health center at Kemp's Corner, we have a whole team. So if a child or a teenager or a parent comes in, what we do is a screening appointment where a mental health professional or a psychologist, and that is the first point of contact usually that you can approach, right? To clearly know then whether is this something clinical, because you may be going through symptoms and you may not know, right? You may just feel, okay, it's a phase, or maybe I've lost someone close to me it's been 6 months, but I'm still not being able to function. Is that bereavement because I've lost my parent to death? Or am I actually going through depression? And do I need clinical intervention for that, right? So you need to actually see any mental health professional will be able to direct you then whether you need a combination of both or you need just either psychiatric intervention through medication or then counseling or then both. So any mental health professional can make that decision for you. You don't have to necessarily make that decision.
All right, sir. And just one last question. This is more of a summary of 3 or 4 questions where they've all said that they have people in their lives who are dealing with various issues: depression, narcissism, drug abuse. But the people in question right now are refusing to take the help they need. So how do you convince them?
So that's a super question, and that's what we also deal a hell of a lot with, because sometimes we're seeing it with friends, we're seeing it with close family members. You've done your reading, you've done your research, you know that person needs a professional support or mental health support, and they don't have the insight. So a lot of psychiatric conditions itself is a problem. So having no insight into your own problem is the problem. So it can also be like, for example, when you're psychotic, right? When you've lost touch with reality, or you're breaking down into psychosis or say schizophrenia, you have no clue that you're actually, your behaviors or your thoughts or your feelings or your conversations have altered or imbalanced, right? So it's obviously the loved ones. So this is where strong family members, loved ones, someone that person can relate to, can trust, and sometimes having group meetings. So sometimes I know 3-4 friends or family members come together and sit down across that person in concern and be very clear that because we love you unconditionally, because we care for you, we need you to seek help. Like, for example, if you know that someone's got pneumonia or is got a bad chest and lungs and is constantly smoking and is not taking help and is getting sicker by the day, you're not going to sit back, right? You will eventually take charge and take that loved one to seek the right medical help. So in the same way, one has to not force, but be quite firm and sometimes authoritative that you need help. And sometimes we also tell the client who's completely anti that, okay, go once. And then it's up to us. You see, we have a lot of cases like this. So it's up to us then as professionals to strike that balance, create that rapport, because at first 10 minutes for us is everything. Once we build the trust, the rapport, we share with the client that these things are confidential. Usually it's a win-win situation for us then.
All right. Thank you so much, sir. This was really insightful. We look forward to many more interactions between us and you. At the Rotaract Club of Mumbai, Nariman Point, we're really thankful for this insightful lecture. Many of us are probably going through these things, but it takes someone to tell us that we're going through it so that we know it. You've shown us the markers as to what we're going through. We hope that we at Rotaract, MNP and MPower can collaborate in the future and create a change in the world. Thank you so much.
Thank you. Thank you all so much. Take care.